Hello, and welcome to Module 2 of the Rural and Frontier Local Board of Health New Member Toolkit. My name is Valerie Quape, presenting on behalf of the University of Nevada, Reno, and the Nevada Public Health Training Center. This series of training modules will discuss the purpose and functions of local boards of health, and is appropriate for use not only by boards, but also members of governmental, healthcare, and community organizations who may be working with local boards of health. After reviewing this module, you should be able to describe the 6 functions of governance as it has been published by the National Association of Local Boards of Health, or NALBO, as well as being able to describe examples of how local boards can implement the 6 functions in their activities. But what are the 6 functions of governance? As described by NALBO, the 6 functions include policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and finally, oversight. Let's take a closer look at each of these functions. The first governance function that we will look at is policy development. NALBO describes the board's role in policy development as the ability to lead and contribute to the development of policies that protect, promote, and improve public health while ensuring that the agency and its components remain consistent with the laws and rules, local, state, and federal, to which it is subject. Again, that is a rather broad statement. Let's dig a little deeper into the Board of Health's role in policy development. One way local boards of health can participate in policy development is through organizing internal policies or plans that will dictate the direction of the board or the organization it governs. This is done through the definition of the board's mission, vision, and values, and then by defining community health goals and measurable objectives for the activities of the board itself. This may often take the form of a strategic plan. In Nevada, some boards that do not oversee a health department have seen success in having a board-specific strategic plan, while boards overseeing local health departments or districts can engage in their strategic planning processes to represent the needs of the community. But where do evidence-based practices fit in? First, let's understand that when we talk about evidence-based practices, we are talking about those which have been developed using the results of high-quality research as evidence. The board can adopt appropriate public health regulations and ensure that they are enforced. This would include food safety inspection regulations and sanitation codes, or could even be as extensive as air quality regulations or other sanitary regulations regarding sewer or septic systems. And by putting regulations in place regarding the control of infectious diseases and other more comprehensive health and safety codes depending on the needs of the community. That brings us to the second function, resource stewardship. NALBO describes this as the ability to assure the availability of adequate resources, legal, financial, human, technological, and material, to perform essential public health services. Let's talk more about what this means for local boards. Some of the main activities in which local boards of health can participate to engage in resource stewardship include ensuring that any staff or departments they oversee have adequate facilities to complete their work, as well as the legal resources to ensure that they are acting within the law. Facilities are often provided by city or county government and may share space with other governmental entities. Legal counsel may be provided by the district attorney's office. Local boards can also leverage oftentimes slim resources by developing agreements with neighboring cities or counties to share services needed in those respective counties. This is often called cross-jurisdictional sharing. And finally, boards may be involved or directly responsible for developing or approving a budget that is aligned with the identified agency needs. Next, let's talk about the board's legal authority. This is described by NALBO as the ability to exercise legal authority as applicable by law and understand the roles, responsibilities, obligations, and functions of the governing body, health officer, and agency staff. By and large, the legal authority of boards of health in Nevada is outlined by Nevada statute. However, there are several factors that should be kept in mind as the board uses authority granted to them. The board must ensure that it acts ethically and abides by the laws and codes to which it is subject at local, state, and federal levels. The board must also ensure that not only are mandated public health services provided to the community, but also that these services are of high quality. This should be done by working closely with the organizations that provide those services. Examples of this in Nevada could include establishing an appropriate fee schedule for health permits or ensuring that disease investigation services are provided in the community. As you may be able to guess from the two previous points, there may be times when the board needs to utilize the expertise or services of appropriate legal counsel. As discussed at length in Module 1, engagement of community and state partners is the foundation of public health practice. In terms of the work of local boards of health, LBOH describes partner engagement as the act of building and strengthening community partnerships through education and engagement to ensure the collaboration of all relevant stakeholders in promoting and protecting the community's health. Well, what does that mean for a board member that has many other duties? First, as an elected official, members of the board represent large groups of people, all with varied backgrounds and interests. It is important that board members engage stakeholders and representatives from many different groups and backgrounds, specifically when a course of action is to be taken that could have a big impact on community health. Members of the community at large can also serve as important partners in various public health projects. Which leads us to our next point. Engaging in open, two-way communication between the board and a broad group of stakeholders can be one way of ensuring that the services delivered meet the needs of the community as a whole. With their unique insight into the needs of their constituents, board members play a vital role in linking layers of the public health system together, whether it be by directing the course of action of a local health department or by working with another public health agency that is contracted to provide these services. They are the link between the public health service providers and the community members. And finally, by convening this broad stakeholder group and maintaining two-way communication, local boards of health can help ensure that public health programs are developed and implemented in such a way that negative impacts are minimized and positive impacts to community health are maximized. Given the dynamic nature of public health, continuous cycles of assessment, evaluation, and improvement are vital to ensure that current services address the community's current needs. As community members yourselves and board members, you are well aware that the physical and financial health of communities can change over time, which is why it is important to routinely evaluate, monitor, and set measurable outcomes for improving community health status and the public health agencies or governing body's own ability to meet its responsibilities. This might sound daunting, but there are many ways in which boards can engage in continuous improvement. First, boards can engage in continuous improvement through regular community health assessments, also called community health needs assessments. Comprehensive community health assessments can give the board a picture of what the current needs are of the community, as well as having the potential to provide data regarding the health trends over time if the assessment processes are implemented consistently. We will talk more about this in Module 6. In addition to attending to overall local system performance, holding the board itself, or if applicable, the director of the department it oversees, to high but attainable performance standards can be another way that the board can engage in quality improvement efforts. Relating to the function of resource stewardship, regular evaluation of budgets and other funding allocated to public health is a part of this board function. Board members and other stakeholders can engage in continuous improvement through participating in professional development opportunities and seeking out training when needed. Well-trained staff are required to develop, implement, and evaluate high-quality programs and services. And finally, if the board oversees a health department, supporting the agency's quality improvement or performance management culture can be done through asking for reports of progress on various quality improvement projects, or even by helping link the health department to partners or other resources that may be needed to improve performance of the department as a whole. The last of the 6 functions of governance is oversight. This is described by LBOH as the ability to assume ultimate responsibility for public health performance in the community by providing necessary leadership and guidance in order to support the public health agency in achieving measurable outcomes. Members of the board can first and foremost provide oversight through participating in official board functions as well as in related activities as they are able. This provides context and personal experiences for members of the board so that they are better able to evaluate how well public health programs are being implemented in their community. This can be of particular importance when making financial decisions regarding staff salaries or contract amounts. This next bullet does not directly apply to boards who do not oversee a local health department, but oversight of the operations of a health department is a common responsibility of local boards of health. Ensuring that the health director position is filled and that the director's performance is evaluated at regular intervals is a part of some boards' oversight duties. In addition, the board should keep two-way dialogue open with the director. And lastly, through their existing governmental connections, boards have the ability to connect different departments and governmental agencies to form new public health partnerships. As you can see from the material we've reviewed, the 6 functions of governments can be implemented in various ways, based on the nature of the statewide public health system, resources available, and community priorities. For board members who are interested in seeing how their board functions against the 6 functions of governance, a checklist tool has been developed and published by LBOH and is available for free on their website. It is recommended that boards complete this simple assessment so they can evaluate the board's current functionality and identify both areas of strength as well as those for improvement. Also, it is important to note that this presentation has just scratched the surface of the 6 functions of governance, and there were many details that have not been included. Please see the NALBO website for more information. You can do so at www.nalbo.org. Now that we've completed Module 2, let's look at the other content that will be covered throughout this toolkit. In Module 3, we will look at Nevada's statewide public health system and how boards of health in rural and frontier counties fit into that structure. In Module 4, we will identify the different types of organizations that make up the public health system at the local level. Module 5 will review how Nevada revised statute dictates the powers and authorities of local boards of health. And finally, Modules 6 through 9 will discuss ways that boards can work with their local public health system to address issues faced by their constituents. This includes engaging in community health assessment, multi-sectoral improvement planning processes, building and implementing a board-level strategic plan, and ways to include quality improvement and program evaluation methods into their plans to improve efficiency and effectiveness. Thank you for reviewing Module 2. Please be sure to complete the short evaluation quiz associated with these materials. If you have any further questions, please contact the Nevada Public Health Training Center.